On today's World Insight, all systems go for the BeiDou navigation system. The significance of this technology milestone from space experts.
Successful launch yesterday can be called a milestone.
And the state of COVID-19 in the United States, what's fueling the surge in coronavirus infections. Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. We begin with the celebrations over a technological feat that Chinese engineers have been working on for nearly 3 decades. On Tuesday, China launched its final satellite to form its own global navigation network called BeiDou Satellite Navigation System. The constellation of satellites now gives the country its own navigation system that rivals GPS. The system is able to serve global users with positioning, navigation, timing, short message communication, and international rescue services. Work on BeiDou began in 1994, and a partially built system had already been providing services since 2019. Now that's complete, global users will finally be able to access everything it has to offer. For more, joining us in Beijing, Yang Yuguang, professor at the China Aerospace Science and Industry Corporation, and in Washington, D.C., Amitabh Ghosh, who is the chair of the Science Operations Group under the NASA Mars rover mission. Welcome to both of you. Dr. Yang, professor, tell me about your reaction to the latest success. You were involved in the overall process of the BeiDou system.
Well, the successful launch yesterday can be called a milestone for the construction of the BeiDou navigation system, also a very important milestone for China Aerospace. You see that the BeiDou navigation system has already have 3 generations. The first generation, we use 2 satellites to provide services for limited numbers of users on the ground. From the second generation, we can, theoretically speaking, provide services to infinite numbers of users, but only for those in the Asia-Pacific region. For the third generation, last year we have completed the basic configuration of the system, and this year we launched the last satellite of the constellation, so we can provide comprehensive service for users all over the world.
That certainly is good news. Let me go to Dr. Ghosh. Hearing the news from Washington, I guess it's a different perspective.
Right. So I think increasingly, many countries it is natural that many countries will develop their own capabilities. And you're seeing this in space, and you're seeing this in technology as well. So you know, I was reading couple of years back, I think India also has started building a global positioning system. So this is, of course, a very good, I think, developments in the technology fora can make life only better for wherever on Earth this happens. So I think if you look at our life today, there's a term called geotagging. You know, it was unheard of. When I bought my camera 10 years back, there was a geotagging feature which let every picture be known wherever it was taken. And at that point, I asked, why would I want to know where I took the picture? But now, that is very, very fundamental to our lives. Anything we do, if I'm ordering pizza today, I want at this point to know where the pizza person is on the road, how many millimeters or how many meters away or kilometers away from my home. So I think this is a very welcoming situation that China also has will soon have its own system, so it can only mean a better quality of life on Earth.
We hope that is the case. According to the latest NASA description of BeiDou system, after the successful launch from China, the BeiDou navigation satellite system has been independently constructed, developed, and operated by China taking into account of the needs of the country's national security, economic and social development. As a space infrastructure of national significance, BeiDou system provides all-time, all-weather, high-accuracy positioning, navigating, and also timing service to global users. That is the description on NASA's webpage about its own feedback and description of the BeiDou system. Now, Dr. Ghosh, how do you see the competition among various systems, and how far is BeiDou system from catching up with its bigger counterpart, the GPS system?
So I think since they have launched it this year, it should be comparable in technical capability. So I'm not exactly familiar with the exact technical features. Having said that, see, I think there is no real competition. I think there is some maybe competition, but each system has to cater to its own users. Mm-hmm. And in this country, in this context, it's their own country. So right now, as I said, in a commercial sphere, everything is geotagged. We have the iOS world. This is the iOS meaning Internet of Things world. You want everything tagged with a geographical location, and not just once. You want continuous tracking. So I think in the space infrastructure fora, this is the more capability that you have, and I think increasingly countries will develop capability, I think it will enhance the user experience on Earth.
Professor Yang, your take now. China, after the successful launch, has been talking about the significance of its success, including its significance of scientific development and as well as national security. So even though your NASA colleague, Dr. Ghosh, has been very polite in expressing his views about its more diversity rather than competition, Professor Yang, the underlying meaning of all of the latest development does put ourselves into a very different situation, I would assume. What about your comparison between BeiDou system and also the GPS system?
Well, honestly speaking, Dr. Amitabh Ghosh is not only very polite, but also I totally agree with his opinion. You see that from the view of commercial aspects, they do have some competition. But you know that because of the very distinctive features, technical features of the navigation satellite technology, if the users can receive signals from different constellation systems, the user can get more accurate precision and more accurate timing. I should also emphasize that with different accuracy, you can do different things for different applications. For instance, if you have only accuracy about 1 to 2 meters, you will have no difficulty on navigate yourself to anywhere in the city. But if you have a higher accuracy, you can also do much more things that you cannot imagine that before. For instance, for monitoring the movement of the railway tracks to ensure the safety and other things. And the several days before, there were also a very interesting application to measure the altitude of the mountain Everest.
Having said all of this, how much do you think the BeiDou system will provide its service, and how fast, Mr. Yang?
Well, we should also know that you see the space, the GPS has a much longer development history than the BeiDou system, and also we should see that today the whole industry, I mean not only the BeiDou navigation constellation itself, but also the downstream industry has already grown to the amount of about 100 billion yuan. In the future, it can be comparable with the whole industry of GPS for almost 1 trillion yuan. So we still have a very long way to go. But BeiDou also has its own very good advantages. For instance, the BeiDou navigation system, since the first generation, it can provide short text messages. These short text messages has to very great contribution to the disaster reduction, such as those in the Wenchuan earthquake. The rescue teams can use this short text message to provide very useful information for this kind of goal.
So what you're saying, it seems, is that BeiDou system can be complementary to what is already existing a system worldwide. Dr. Ghosh, do you agree? Will this be a geopolitical battleground just as 5G has been?
See, I don't think it is going to be like 5G.
Tell me more.
I do want to pick up with one of Dr. Yang's points, and I agree with him. So when you build an infrastructure service, and this is like an infrastructure service, the applications come down the road. And so the numbers that he quoted, that how much business it has generated, that will only grow. And so that means more and more people are finding it useful. And that is all a good thing. So when the US first started its internet service, so many people were skeptical as to why are you trying to spend money here? Why would people want to send an email message? Because there is the postal service, right? So here also there are many things which we perhaps don't apply the global positioning system to, which we will find a usefulness to geotag. So there will be many local uses which will validate the system, validate the building of the system.
Well, there is a very interesting application related to your question that I have discussed with my friends from Switzerland to use the signals of the navigation satellites for the positioning of the probes near the cislunar space. So this is a very interesting one. In the future, if we can have more sensitive receivers and also it has a bigger antenna, it is possible for these probes either on the lunar surface or in the orbit in the cislunar space to receive the signals from navigation satellites, either from GPS or BeiDou navigation system to have a more accurate positioning. So this is, you see, this is a good start for the future potential application of these kind of services in the pure scientific research and space exploration. And I also emphasize that this field is very good for us to cooperate together. And there is also another very good example. Although it is very difficult for China and the US to cooperate now in space field, but the NASA has raised their request to use the Qiao or the Magpie Bridge data relay satellite for the future potential missions of NASA on the far side of the moon.
Will this be opportunities that all sides can tap into, Dr. Ghosh? What do you make of its role for future aerospace exploration?
If you think of this is beyond country, if you are building a really new capability, then it is a different level, I think. So for example, Elon Musk is trying to build this new spacecraft which will take 400 people to Mars. Well, if he's successful, he sets a different infrastructure standard for space transportation, for space tourism. So that is one type of infrastructure. So here you have a competing capability being generated, and it is there for a purpose to serve the local population, and of course there must be other uses as well. You can go to the global market and you can avail a few providers to do a specific job. So why specifically why would you choose two specific providers is not very clear, but I think we have this everywhere. We have many cell phone companies, we have many companies that provide email and social networking, and so that is how the world infrastructure market works.
One of the things that we haven't really talked about, but it's really the underlying thing for everything we have talked about, is the geopolitics. I don't want to overemphasize on that, but really the world has changed. As we have seen, whether the pandemic over the past half year or the pandemic plus geopolitics, how much it has meant for all of us. So Professor Yang, if I could be upfront with you and point out this white elephant in the room, can you help me to understand how much independence China would feel as a result of the success of BeiDou system from what some in China believe as the control of technology and the outer space by the United States as a result of the earlier GPS system?
Well, you see that the navigation satellite system, the constellation and also the whole industry is very important for all countries, especially those space-capable nations, for their either their security, the national security, and for the daily life. So big countries, especially the space-capable nations like the U.S., Russia, and China, and Europe, all develop its own navigation system. You can use the system of other countries, but it is very necessary for these countries to develop its own system. You see, India and Japan also develop their own system. Either it is a regional navigation system or a navigation enhancement system. So this is very necessary for the country, and also it will promote the development of high technologies for these countries, not only for competition with other countries, but also from the global view, you see that China is promoting its One Belt, One Road strategy. From the second generation of the BeiDou navigation system, it can already provide very important technological infrastructure for this strategy. And for future in the global wide, it can also help other countries, and benefit will be it will be a win-win game for China and its partners to work together. So the navigation system provides a very good platform for these kind of cooperations. And from the political view, I think that there do not have essential conflict between China and the U.S.
But size does matter. Scale matters too. And who comes first also matter a great deal, because whoever comes first will already attract so many users, and big data is extremely crucial. So Dr. Ghosh, how do you see the competitive edge from now on, whether it's BeiDou system or other navigation system by Japan, India, Russia, and Europe? How do you see the competitive edges of these systems?
See, I think there's obviously an advantage for a country to develop its own navigation system. But having said that, ultimately the private sector who implements some of these uses will make the call of which system to use. And so there is an incremental benefit, I feel, because the service is already available in the marketplace, but at the same time, it is very important for a country. And otherwise, no country would have developed its own system.
That's right.
That is the whole reason different countries have different systems, because they want to make sure they're not shut out.
Right.
So
finally,
that's obviously there.
Yeah. Finally, before we go, I want to have your view briefly about the commercialization of the service, whether it's a GPS or BeiDou system for the future, or the other systems. Commercialization really important, because that works with the market. How do you see the potential of BeiDou system, Professor Yang?
I have mentioned that there are more applications in the future because the increasing accuracy. There are many applications that's quite different from before. You see, for the reliability, you see sometimes we need to coordinate all the positioning system with very high reliability. So in this case, we should choose the receiver which can compatible with different systems such as GPS and BeiDou. So this will be more reliable. And in the future, we can have, if the accuracy can reach to centimeters level, so we can have more accurate applications, such as monitoring the earthquake and others.
I see. Dr. Ghosh, final words too.
So I think the future is where it is all is. Anytime you build an infrastructure system, all the benefits are not apparent. So the same example I would give is when you started doing data cables in the United States in the 90s, and when the internet was just starting out, who would have thought that there would be social networking 15 years down the road? And who would have thought that social networking be such an important part of commerce? So here also, the location of objects and people at all times is a very important problem for industry, for individuals. So I think going forward, there is a huge amount of applications.
Amitabh Ghosh, Yang Yuguang, thank you so much for joining us. All the best. Be well.
You're welcome.
You're watching World Insight. Coming up on our program, no signs yet of a flattening COVID-19 curve in nearly a dozen states in the U.S. Why the bleak prognosis? We will get down to the science behind the infections right after the break. Welcome back. You're still watching World Insight. I'm Tian Wei. Now let's turn to the raging COVID-19 pandemic in the U.S. The country has already reported over 2.3 million cases and more than 120,000 deaths as of Tuesday. 10 states have reported record numbers of new coronavirus cases last week. Another 9 states are also seeing record high 7-day averages, along with a swell in hospital cases. The surge in new infections comes as states began reopening. Residents are being advised by some states to take social distancing measures more seriously. Dr. Anthony Fauci, the leading figure in the White House coronavirus task force, has warned anti-science bias in the U.S. has become really problematic. For the latest on the COVID-19 pandemic in New Haven, we have Xi Cheng, who is Associate Professor of Health Policy and Economics at Yale School of Public Health. In Providence, Dr. Megan Rani, who is emergency physician and lifespan from Brown University. And in New York, we have Vincent Raccaniello, Higgins Professor at Department of Microbiology and Immunology at Columbia University. Welcome to the three of you. We got great experts coming from 3 well-known universities. I want to have, first of all, your assessment of the latest situation inside the United States.
Yeah, in short, it's a mess because we had 2 months in lockdown to get ready for this, and we didn't do anything. We're not testing enough. We're not wearing enough face masks. We're not keeping physical distance. We're doing everything wrong because there's no direction from above in this country. It's left to the states, and they don't have the resources or the abilities to do that. Some states have done well, others have not. And perhaps most problematic is that many Americans think it's over. They think the virus is gone, and it's still here. So I'm afraid to say that this is going to continue for a long time until we have a vaccine, unfortunately.
Well, Dr. Megan Rani, tell me more about how do you see the recent opening up and then closing down of some of the states inside the U.S.? Which stage are we in now?
So many of us in medicine and public health feel that we still have not gotten out of the first wave of COVID-19 across the United States. We've seen a significant decrease in the number of cases and hospitalizations in the states of the 3 of us tonight: New York, Rhode Island, Massachusetts, Connecticut. We reached our peak, and thanks to shutting down and good public health measures, saw a decrease in the number of cases, hospitalizations, and deaths. But other states, particularly in the south and the west of our country, are having daily records broken in terms of new cases, the percent of tests that are positive, and of course, and this is dominating the news today, the number of hospitalizations, particularly in the state of Texas, that are overwhelming my colleagues down in San Antonio and Houston right now.
How should we understand all of this latest development, Xi Cheng? U.S. is such a huge country. Whatever is happening over there is going to have a huge impact on the world's performance of containing COVID-19, and will also have a huge impact on how this current wave is being dealt with and what is the real content of the next wave if there were another wave. Xi Cheng.
Yeah, indeed, we are all in this together, and I think the main issue for the United States, and which also been affecting the rest of the world, is we're delaying the actions to ramp up the testing and tracing, for example, compared to South Korea, which is a very good example because both countries found the first case on the same day. But the U.S. was only able to catch up with South Korea in terms of testing after 100 days. So during those time, the travel was throughout the world between US, Europe, and Asia. But the testing was not giving people information about their risk.
Right.
And I think what's very worrisome is still at the national level, at the federal level, there's no national strategy in multiple fronts.
We see political situation inside your country also getting ever more complicated. Do we know, scientifically speaking, Professor Raccognano, how much impact this will have on the current, already challenging situation in the U.S.? For example, do we know to what extent the demonstrations and the close contacts among those demonstrators and also onlookers, as well as among the police, will have in terms of new numbers?
Unfortunately, it's hard to know what the impact of the demonstrations, close contact will be. We saw a surge in cases in the U.S. after Memorial Day, when people went outside in big numbers and got close to each other about 2 or 3 weeks ago. So the assumption is after the demonstrations we are going to have increases as well. And I did myself go to a demonstration 2 weeks ago, and everyone there wore a face mask and stayed a good distance apart, but that's not the case at all of them. And as you said, when the police get involved, then there's more contact. I do think that it's necessary to do these things. This is very important in the scheme of the U.S., you know, many people think it contradicts what we've been saying all along, but I think this transcends the infectious disease, and we have to learn how to deal. I think it can be done safely. The problem is that many people don't wear face masks and get too close to one another, but if they did, I think we could control it.
Dr. Rani, to what extent the political rallies will have on the control and containment of COVID-19? We saw the incumbent president having his political campaign not necessarily asking people to wear masks, but only say it's an optional. So from now on, things like that will happen at much closer frequency. What would that mean? Is there some scientific research about that?
So there's been no research to date about the effect of rallies, but I will say from a scientific perspective, going off of Dr. Raccognano's comments, the things that scare most of us about those indoor rallies are precisely that they are indoors and people are not socially distanced. If you looked at the pictures from Trump's rally on Saturday night, there were not necessarily a lot of people in that stadium, but gosh, they were packed awfully close together. There was no 6-foot spacing in between the attendees at the rally, and there were very few masks worn. So if there were people who were positive for COVID-19, and we've seen from churches and choirs that there's a great spread of virus when people are in those closed spaces and yelling or singing, and we're all concerned that the same thing could be happening at rallies. It is not, from a public health perspective, the world's smartest decision to make, to put people close together without masks or without social distancing in an indoor space.
Starting from Dr. Fauci to many different other experts, including the three of you who are, you know, certainly expressing your concerns and worries. And do people really listen to your words? Do your words still matter currently?
Since 3 of us are all at the East Coast, there is one phenomenon I want to bring up is the coordination between the states in East Coast, especially Northeast Coast, 6 states: Connecticut, New York, New Jersey, Rhode Island, Pennsylvania, and Delaware. And those 6 states announced in April creation of a multi-state council that developed a regional framework for safety and for gradually lifting the stay-at-home orders. And that council was composed of economists, public health researchers. That was a good example that those voices from scientists, from economists can be heard by the governors and to make a decision about the reopening.
Same question I want to ask to the other 2 professors.
It depends where you are in the U.S. I think many people would like to get good advice from public health officials, physicians, and scientists, but there are many others who distrust science. You know, there's a general distrust of science among many people in the U.S., and it goes not just to infectious diseases, but to things like climate change and environmental issues. And experts are not trusted. So instead, people listen to news programs, perhaps, or politicians where they get the wrong message. So I think this is a problem with this outbreak.
Dr. Rani?
So I think there are a couple parts to it. So when you look at public surveys of who people trust, most people say that they do trust Dr. Fauci. I think many of our nation's most preeminent public health experts have unfortunately been largely missing from the discussion. We've heard from Dr. Fauci, not as frequently as some of us would like. We have not heard a lot from Dr. Redfield, who runs the CDC, right? And there are other national public health experts at all who have been largely missing from the discussion. That's really too bad on a federal level because they failed to set the standards which can guide all of the states. That said, when you do look at surveys of Americans, the majority of them do still support physical distancing and mask wearing. The trouble becomes we're all human, right? And if we don't personally know someone who's been affected by COVID-19, it becomes very difficult to maintain these precautions when you go into weeks and months and you look ahead and you don't see a clear end in sight if you're not getting clear messaging from above. And that's where that governmental messaging is so critical from the federal level and then from the state level. And so as Dr. Chen and Dr. Racaniello have mentioned, that's why we're seeing a big difference between different states. So I would say that the public health perspective and the scientific and expertise of the three of us and of many, many other folks across the country are being listened to in some states, but not necessarily in all. And I think that we have to do a better job of our public health messaging. Unfortunately, we do depend a bit on government, politicians, and on influencers to help spread that message, particularly to populations that have not yet been personally affected by this disease. If you go to New York City, it's a little easier to convince people, but even there, they're tired right now, right? They're tired of staying inside, and that is human nature. And so we have to make it easy for people to do the right thing.
Earlier in China, during the first stage of the outbreak, things were devastating and people are so concerned. Even during the latest spike in Beijing, many people are concerned what the future is going to be like. So I want to genuinely ask the three of you, who you are there in the U.S. I mean, why shouldn't there be more care about human lives? You know, if I see it as a journalist, a story, but really you're functioning inside such a situation. I want to have your personal, you know, approach to what is really going on here, Professor Racaniello.
It's very hard. Even though life looks normal from the outside, you know, even in New York City there are fewer people around. It looks more or less the same, but if you start talking to people, I've been speaking on a daily basis with a physician who's taking care of patients, an infectious disease physician, and it's a horror show. And so my view of this is that it all could have been prevented from the very start, and it's frustrating for me, on top of all the other problems we have, mainly caused by the current administration, I should say. Now we have this natural disaster, which could have been dealt with in an efficient way like many countries have done. Your country, with far more people than we have, did an incredible job at restricting its spread, and we could have done so as well. So I am personally very frustrated, and I tell everyone I can talk to, you should be furious that in a country like the U.S., with the science and medicine that we have, that we couldn't stop this. It's completely unacceptable, and for it to be shrugged off a few months ago by our president, it's just unbelievable to me.
Dr. Rani, you and I were talking about the PPE, and the PPE over the past few months. Now, I don't want to repeat that conversation, but really your personal account of what is really going on around you, whether are they really reflected in the public discussion and domain? Are policymakers really looking at the situation?
Yeah, I couldn't agree more strongly with Professor Racaniello that this is just so unbelievably frustrating for all of us to see that we messed up in February and March. Well, now we have a breather. We have a moment where we could stop this from spreading again, and we are simply not taking advantage of the moment people are exhausted, and this has been presented to Americans as this false choice between preventing spread of the virus and keeping our economy closed. There is a way to reopen, to allow people to have some socialization, to allow the economy to restart, to get our kids back to school. I'm a parent of 2 little kids. This is exhausting, I'll be honest.
Yeah.
But there's a way to do all of that and to do it safely, to minimize spread of the virus, so that we don't face situations like what are happening in Texas right now, like what we faced in Connecticut, New York, Rhode Island, and Massachusetts, New Jersey, a couple of months ago. And I think we're just all unbelievably frustrated and trying to figure out the best ways to influence policy. Again, those of us on this interview are lucky to have state governors who are focused and who are listening to science, so our states may be okay. But I think there is this larger messaging that needs to be taken to protect us. And you know, it's no fun to feel like the killjoy, to be saying, well, no, we all have to stay home, we have to stay distanced. But at the same time, you know, there's an ice cream shop in my state that just posted on Facebook how frustrated they were because their kids who are working at their ice cream shop are getting yelled at and insulted by clients who are showing up and wanting to order ice cream and sit on their deck without masks on. That's not fair to those kids. It goes against my governor's orders. And it's simply infuriating because it puts the rest of the community at risk. So I think we're all tired, we're frustrated, and we're trying our best to create a better situation going forwards, but it's going to take the community coming together. And although I think most Americans are on board, it just takes that, 20% to kind of ruin stuff for the rest of us, unfortunately.
How much evidence and numbers should we gather to figure out whether the United States by itself will become a place of herd immunity if the current situation continues?
So for us to reach herd immunity would require infection of such a large proportion of our population and would likely cause such tremendous numbers of hospitalizations and deaths that, to me, that is not a valid thing to try for. There are a lot of questions for us to answer still, but the current data is that we are nowhere near herd immunity. And the scale of destruction that would be caused by pursuing that strategy would just be more than I think our society could take.
Is there a possibility, Professor Racaniano, that at the end of the day, is herd immunity the way to go? Our policymakers now in Washington secretively thinking that probably is an option. After all, it is not controllable right now, cannot be contained, COVID-19 in the U.S. Do you suspect that? I don't want to use conspiracy theories, but it seems that the phenomena is only leading all of us to suspect that.
There's no way, as Dr. Rani just said, that we can achieve herd immunity without losing hundreds of thousands of lives. Even if the fatality rate is 1 and 1.5%, if you want to infect 200 million Americans, that's a lot of deaths. So that can't happen. Although in many states, the infection is running rampant. I think what we have to do, as we have said before on this show, we have to do a better job at testing, tracing, and isolation. We're not anywhere near what we need to do, and that's the key to reducing the number of infections. If we know, for example, that people less than 60 years of age generally have a mild infection, we can use that information and tell older people who are at risk, perhaps are not working, they need to stay home. And the others who are out and about, they have to wear face masks. Every state has to require face masks, and we're just not doing that. So we don't need to have herd immunity until a vaccine is available. I don't think that's necessary, but we're not protecting ourselves in the meanwhile, and that's the key.
There are so many things that can be done, even at the current stage. Agree, Xi-Cheng?
Yeah, indeed, I agree with the other two guys, and I would say that we are not putting anyone's, especially the general public's lives on this bet with the herd immunity. And even if that's true, that we do not know how long the immunity could last.
I want to wish all of you good health, so are your beloved ones. For now, I want to thank the three of you passionately helping us to understand all the latest development and also be able to openly voice your expert views. Thank you so much. Xi-Cheng, Megan Rani, Vincent Raccaniello. Thank you so much. All the best.
Thank you.
Thanks for having us.
Pleasure.
And that's all the time we have for today. If you'd like to see more, you can certainly search World Insight in the search engine or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei on behalf of the team. Thanks for watching.